thank everybody for being here, and let me thank our very esteemed panel of people who have spent their entire lives fighting for quality health care and disease prevention in this country. Let me just very briefly introduce some of our panelists before we begin. Dr. Abdul El-Sayed is a physician, he's an epidemiologist, he's a public health expert, and former health commissioner for the city of Detroit. He was formerly a professor at Columbia University's Department of Epidemiology and a director of the Columbia University Systems Science Program. Dr. Alison Galvani is director of the Yale Center for Infectious Disease Modeling and Analysis, and Burnett and Stender families professor of epidemiology. She is the youngest recipient of an endowed chair in the history of Yale School of Medicine. Dr. Victoria Dooley is a board-certified family medicine physician and healthcare advocate, and has worked very hard to make sure that all people in Michigan receive health care as a human right. Deborah Burger is the National Nurses United president, and the National Nurses United is the largest nurses union in the country, and she is one of the country's top nursing leaders and an outspoken advocate for health care for all. Greg Whitten is the former Special Assistant Secretary of Defense for Nuclear, Chemical, and Biological Defense Programs at the Department of Defense. Mr. Whitten worked for the Obama administration and will speak to the creation of a defense response to epidemics and how the Trump administration has failed. I think the main point that I want to make before I turn it over to the experts is that when you have a global infectious crisis which is endangering people all over the world, the people of the United States, and in fact the people of the world who look to the United States for leadership, want to know that we have an administration in this country whose decisions and comments are based on science, not based on tweets that have no scientific basis, not based on politics, not based on policies designed to protect the wealthy and the powerful. And let me just quote, if I might, just a few, and there are many more, comments made recently by President Trump. President Trump, I think, is quoted as saying that he has a natural, quote unquote, a natural ability, end quote, to understand the coronavirus, and that that virus will end by April. Donald Trump does not have a natural ability to understand the coronavirus, and his reckless statements are confusing people in this country and all over the world. Donald Trump has congratulated China on its effort when in fact the entire world community understands that because of the lack of transparency in China, this situation is much worse than it should have been. Donald Trump has said that, quote, so if, we have thousands or hundreds of thousands of people that get better just by, sitting around and even going to work. Some of them go to work, but they get better, end of quote. Here you have an incredibly infectious disease, and the whole world is wrestling with how we prevent the spread of that disease. To suggest to people that when you are sick, you go to work might be the stupidest advice ever made by a president of the United States, and on it goes. So the first point that I want to make is that we need an administration whose efforts are based on science, and that means that we should not have somebody like Vice President Pence heading up the coronavirus task force. That task force should be a 100% non-political task force led by our best scientists and public health experts, not politicians. If there's ever a time you don't want to mix politics with a healthcare crisis, this is that moment. Further, and importantly, we remain, as all of you know, the only major country on earth not to guarantee health care to all as a right.